Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check. No problem.
Yeah, and what you're trying to say, so I would suggest, one of you sit here and then you sit here. Okay. Sit close and then we try to avoid each other as much as we can, showing social distancing when we can.
Are you gonna sit there, Mr. Mayor, then? Or are you gonna?
I'll probably sit over here, but I start out, so.
And then you can try not to touch the podium, right?
Yes, yeah.
One of
You're
those.
supposed to wipe it down.
That are hard to.
I never touch it, so I forget it.
Right, right.
Okay. Yeah. It's just not that I feel like I'm going to, it's just the habit of doing so, right? Dedicator, because I don't steam my glasses up.
Oh, is that how it is?
Until, because it's easy to put it on one of my ears. And,
Oh, geez.
exactly, so that's okay for us to do as well?
You're welcome to do
Okay,
that.
all right.
How about 3 degrees? What's the difference?
Oh, good, yeah, a little bit muggy, a little more muggy outside.
Yeah, and I'll mention it in the. So, just so you know, right now, they're closed by the state until the 27th for sure, as part of the playgrounds. And then we'll see what the guidelines say, and then we'll make a decision from there. If we think we can open the safe playground. Okay. As part of it will be, if they say no, they have to be disinfected in an hour or something like that. We got 11 of them.
Right, and in some ways, it's the same thing. You really can't, it's pretty hard to practice social distancing in this much better.
Right, right.
Maybe a little easier than in a pool, but.
Yeah. Yeah. If they, I don't know, right, it's kind of the same as a playground, honestly, right? If a playground is safe, is a splash pad safe? I don't know enough about the longevity of the virus. One of the things they are saying is that out in the sun and the heat, it can be pretty quick, so playgrounds could turn off. Just so you know, we are not planning on disinfecting our playgrounds. We have 52 of them, right? So. Well, here's the thing though, if you, because we talked about this, right? What if you
Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check.
I do want to remind the room that we have a live microphone on our YouTube feed right now as well.
I figured I was gonna make a phone call too and see when I could finally get in. But I got mine cut and then fire this all.
I have well,
Put in a couple of pictures.
I have well past due, I can, get in touch with you.
Well, yeah.
I'm gonna try and order in just to see, you know.
3 minutes. Hi, caller 2, could you tell me who's on the phone? Caller 2, can you mute the background feedback? Caller 2, who do I have on the phone?
Am I calling too?
Yes.
Okay, I'm sorry. This is Michael Otts from the Gazette, and this is my first time on here, so I'm probably messing things up.
Oh, no, you're fine. Thank you. I'll mute everyone now.
Okay.
Make sure you use his Facebook feed.
When you have to time, Michelle.
1 minute.
Good afternoon. I'm Cedar Rapids Mayor Brad Hart. Thank you for joining us today as we provide some important updates for you, for residents of Cedar Rapids and really for everyone in Linn County. I do want to begin with a very sincere thank you to all our citizens who are doing their part to help protect the health and safety of our community, thank you for that work. I've witnessed and have heard many stories about people who are helping and compassionate and caring for others, and those are really wonderful stories to hear and things to see. They're not surprising either, because our communities care for each other, and this pandemic just shows that over and over again. As many businesses begin to reopen, it's really important that we continue to be vigilant in our efforts to keep the virus from spreading. Please continue to stay home as much as possible. Practice social distancing. Wear a mask when you can't social distance. Wash your hands often and clean surfaces frequently. For businesses, a business reopening toolkit is available on the city's website on the COVID-19 page. This toolkit provides guidance for businesses as they work towards reopening safely so they can serve their customers and protect their employees. We do have a few important announcements about the city buildings and services. First, the City of Cedar Rapids is extending the time when our facilities will remain closed to the public until May 31st. This includes City Hall, the City Services Center, Cedar Rapids Water Administration, the Central Fire Station, the Animal Care and Control, the Cedar Rapids Police Station, and the Northwest Recreation Center. The city's emergency services continue to operate, and services are still available to the public via email or online or even the telephone. Some good news: our city's transit system will resume beginning Monday, May 18th, and Brad DeBrouwer, our transit manager, is here to provide the details. Brad.
Thank you, Mayor Hart. Again, I'm Brad DeBrouwer, the transit manager for Cedar Rapids Transit. And as Mayor Hart mentioned, we will be resuming fixed route bus service beginning Monday, May 18th. And so some of the details of how we plan to begin this reintroduction of the transit service is that the service will be Monday through Friday, 5:15 a.m. to 7 p.m., with hourly service on all routes, except for Route 5, which, being our busiest route, will continue to be a 15-minute frequency. The reduction in service will be that we will not be providing weekday peak service or Saturday service at this time, with the hope to phase in those services at a later date. Those two reductions, as far as our peak service and the Saturday service, provides additional personnel and buses for us to meet what we hope will be the demand out in this for our service. So passengers will be required to enter and exit the bus through the back door unless they have an ADA accessibility issue that requires the use of the front door. So anyone that has an ADA issue will still be able to go ahead and board the bus as they traditionally would with the ramp or at the bus kneel, but all other passengers will be expected to use the back door for both entry and exiting. There will be no fare collection at this time to encourage the social distancing between the drivers and the passengers. We have installed yellow chains on the buses to serve as a barrier to provide social distancing between the driver and passengers, so that'll give us that 6 feet of separation that we're looking for. We will continue to have hand sanitizer available on every bus for passenger use. The bus capacity will be limited to 10 passengers per bus at this time. And then extra buses will be available for overflow if needed. So we're going to be very flexible as to what our ridership demands or needs are going to be. And so instead of having peak buses, we will actually have some buses that will be trailing along behind where needed as a driver calls in, because they may or may not be full. Passengers will be required to wear face coverings, which would include masks, bandanas, neck gaiters, scarves on the bus or in the ground transportation center. So passengers will be expected to provide their own face coverings. However, we will have some masks available for distribution on the buses and at the GTC. We ask passengers to only use transit for essential use at this time, such as rides to work, the grocery store, or medical appointments. So we will be discouraging social riding or loitering. Passengers will not be allowed to wait inside the GTC at this time, but passengers will be allowed access to the restrooms and the information booth at the GTC. Reminders will be posted regarding proper social distancing, hand hygiene, face coverings, etc., at the buses and at the GTC. We will continue to partner with Horizons and NTS and Linn County Lifts to help fill in any service gaps that we do have. So that will include that Saturday service. Since we're not providing service, we will be contracting again with NTS to help fill that void. And then adjustments will be made to these situations or to these conditions as necessary as conditions change. As far as cleaning and maintenance, the buses in the GTC have all been cleaned and sanitized, and high-touch surfaces will continue to be cleaned and sanitized on a daily basis and throughout the day. The GTC restrooms will be cleaned several times a day as well. All passenger shelters have been pressure washed, and we have been able to acquire more PPE and sanitizers that were unavailable a month or two ago, so we have the necessary supplies to provide proper cleaning and protection. As far as our employee situation, employees will be undergoing daily pre-shift screening and temperature checks. That is a new policy that has been implemented by the city, so we will be doing that as per the policy. Employees have also been provided or will have access to face coverings, face shields, gloves, hand sanitizer, and surface sanitizer. And then the last thing I have to mention is that we will be purchasing plexiglass barriers for the driver compartment that will serve a dual purpose as both an assault shield and a sneeze guard. And we intend to have those in place prior to returning to normal front door use and fare collection. And that is all I have.
Thank you, Brad. I know a lot of people are excited to have our transit system resume. But as that happens, it's going to be really important for everyone to follow the guidelines that Brad and his team have put together to keep the drivers safe and to keep the other riders safe. So please follow those guidelines. I would now like to introduce Scott Hoke, our city's Parks and Recreation Director, who will provide information about the city's public swimming pools. Scott?
Thank you, Mr. Mayor. My name is Scott Hoke. I'm the Director of Parks and Recreation for the City of Cedar Rapids. We have made the very difficult decision to not open the Cedar Rapids municipal pools for the summer of 2020 to protect both our employees and the public. Our staff has spent the last several weeks reviewing the guidelines from CDC for operation to determine if accommodations could be made to allow public swimming at the pools. We also explored the option of possibly having a shortened season at a few of the pools. With over 160,000 typical pool users in the summer, the potential for exposure to COVID-19 still exists even if following these guidelines, due to the number of surfaces at the facility that are touched hundreds of times each hour. In addition, social distancing within the water and life-saving would be difficult. After reviewing all these options, we have determined that these barriers make it too difficult to operate the pools and keep the patrons and staff safe. Our primary goal is keeping the community safe, and we believe that this is the best precaution we can take this summer. We have made this decision early to allow our staff time to find summer employment and plan for other recreational programs. Our splash pads are currently closed due to current restrictions on playgrounds by the state. If these restrictions are lifted and we feel we are able to operate the splash pad safely, we will determine it at that time. We will also evaluate the possibility of opening Bender Indoor Pool later this summer if we determine we can offer swimming lessons in a safe manner. And that's all I have. Thank you.
Thank you, Scott. So many people are having to make really difficult decisions. Those are decisions we're making to protect the safety and health of our communities. Some of these decisions are disappointing. I understand that, and I can only assure you that all of these decisions are being made with the best interests of everyone in our communities in mind. And with that, I'd like to now introduce Dr. Dustin Arnold from Unity Point Health. Dustin.
Thanks, Mayor. Good afternoon. I'm Dr. Dustin Arnold, Chief Medical Officer at St. Luke's Hospital and Unity Point Health. And on behalf of the medical community, I'd like to thank the community for the outstanding discipline that we've done during this time of social distancing and pseudo-sheltering in place. Also, the overwhelming support healthcare workers have received from the community. When you go to college, you learn about the freshman 15, what we're referring to as a COVID 15, all the wonderful meals that were provided and kept us going. But as we start to let up on these restrictions and start to loosen things up, there's one thing that as in my role, I need to be mindful of. We're going to have spikes. We're going to have, whether it's a nursing home or a factory or a school or Boy Scouts, you're going to have a little spike in cases as we start into the summer. And we don't want to see that spike in cases, which will be manageable, to happen at the same time we start to have our patients that have had chronic medical conditions that have perhaps been neglecting them or not getting the care that they need on a regular basis during this pandemic. And then in addition, you add the surgical volume that we are starting to ramp up slowly. So that's one thing we want to avoid. And so to avoid that is, one, we continue everything that Mayor Hart said with his opening comments, but two, Dr. Nate Brady from occupational medicine at St. Luke's developed the Good, Better, and Best system, which I think it really summarizes it quite well. The good is 2 people wearing a mask, and in that situation, the chance of transmission is less. And the better is 2 people wearing a mask with 6 feet of distance in between them. And then the best is 2 people wearing a mask with 6 feet of distance and keeping the interaction less than 10 minutes. I think with those measures in place, and we continue our discipline and continue, as someone else said, use virtual visits when you can. If you can do something over telephone, do that to minimize trips to being essential. And if we can continue with the discipline we have, we'll handle this fine. And I didn't want to be outdone by Supervisor Walker. I know he had a poster one time, so I had to not be shown up. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As of 2 p.m. today, there are currently 886 cases of COVID-19 in Linn County. There have been 68 deaths, and 665 individuals have recovered. 144 Linn County residents have been hospitalized for COVID-19 at some point in time, and 12 residents are currently hospitalized. Linn County Public Health continues to track and follow up with outbreaks identified at Linn County long-term care facilities. At Cottage Grove, we currently have 6 staff and residents that have tested positive for COVID-19, and 2 of those residents have died. 3 residents and staff members have now recovered. At Heritage Specialty Care, 114 staff and residents have tested positive. 25 of those residents have died. And 85 staff and residents have recovered. At Linn Manor, 31 staff and residents have tested positive. 6 residents have died, and 19 staff and residents have recovered. At Manor Care Health Services, 50 residents and staff have tested positive for COVID-19. 9 residents have died, and 20 of the ill have recovered. At St. Luke's Living Center West in Cedar Rapids, 74 residents and staff have tested positive. There have been 10 deaths associated with this outbreak, and 51 of the ill have now recovered. Several of these facilities are moving towards recovery. The health and safety of Linn County is our #1 priority, especially during a pandemic. We understand that many organizations and individuals rely on local guidance and expertise to provide recommendations that are relevant to our community. For that reason, Linn County Public Health has released guidance to provide additional information to our community on mass gatherings and events, general guidance for organizations, and business sector specific guidance. Linn County Public Health recommends a phased reopening in alignment with the Centers for Disease Control and other national organizations. This three-phased approach enables businesses to reopen and events and gatherings to occur, while at the same time protecting the health and safety of employees, patrons, guests, and the general public. Guidance across 3 phases is determined by 10 key disease and resource metrics. These metrics are categorized under epidemiology, healthcare, and public health, and these must be met before moving to a second phase of the reopening process. The first phase of the reopening process is necessary to slow community spread of COVID-19 and avoid overwhelming the local healthcare system. During this phase, recommendations are for limited operations when reopening. The risk of transmission increases as the number of those in attendance grows. While the community begins to move through these phases, prior public health measures to slow the spread of COVID-19 remain the same. Stay home if you are ill, no matter how mild the illness. Continue to practice social distancing by maintaining 6 feet or greater between people not in your immediate household. Wash your hands with soap and water or use hand sanitizer, especially after touching frequently used items or surfaces. Avoid touching your face. Sneeze or cough into a tissue or the inside of your elbow. Disinfect frequently used items and surfaces as much as possible. And use a face covering if social distancing is not possible. Linn County Public Health encourages businesses, employers, event organizers, and the general public to view our recommendations on general guidance, guidance on events and mass gatherings, and business-specific guidance on reopening on the Linn County website at linncounty.org/COVID-19. As our community begins to reopen starting tomorrow, we know this is causing anxiety and uncertainty for many people. The daily stress caused by COVID-19, social distancing, and a deep financial crisis have had a big impact on our community. It is normal to experience feelings of isolation, anxiety, and uncertainty in this abnormal situation. Prioritizing your mental health and staying connected is more important than ever. It is okay not to be okay. If you do not feel comfortable visiting businesses that are opening, you don't have to. Additionally, as a business owner, if you don't feel comfortable opening right now, you don't have to do this at this time. It is okay to take your time and make decisions that are best for you and for your customers. We continue to see more and more cases of COVID-19 that are not linked to outbreaks. This is otherwise known as community spread. We ask all individuals to continue to act as if everyone you encounter could have COVID-19. If we each do our part to protect each other, we will help to reduce the burden of disease in our community. This is hard, It is long. However, we will make it to the end of this marathon together. Thank you.
Good afternoon. My name is Stacy Walker, and I have the honor and privilege of serving on the Linn County Board of Supervisors. As we've said since day one of this pandemic, the safety and well-being of Linn County residents is our number one priority. It is our responsibility as leaders in this community to provide you with accurate information so that you can make smart decisions for yourselves and for the health of your families. As many of you know, the governor is essentially reopening the state tomorrow. This decision is not in accordance with CDC guidance, but we are here now, and it is our job to do the best we can to keep everyone as safe as possible. The guidance I'm referencing states that we should see a sustained daily reduction of confirmed cases for 14 days before proceeding to even a phased comeback. This has not happened in Linn County or other hotspot areas across the state. Linn County public health officials, as you heard, are devising reopening guidance that aims to present the least risk to our residents and prevent our healthcare system from being overburdened by a potential second wave of the virus. As we move forward, we're able to learn lessons from other states that have either reopened or are in the process of doing so. Some areas of the country have learned some pretty hard and tragic lessons. Other areas are benefiting from a more cautious and pragmatic approach. We should keep in mind that the top national expert on infectious disease, Dr. Fauci, has recently warned the United States Senate of the dangers of opening too quickly and without a well thought out, phased approach. Now, we understand that businesses are hurting. That was something we never wanted to see. Tomorrow, many businesses will open again. While that is something we are glad about, we also hope our residents will be smart and responsible in their decision-making for the sake of our elderly and the immune-compromised individuals among us. I do agree with the governor that Iowans have a personal responsibility in this crisis, and the direct actions of each and every one of us shapes the trajectory of this pandemic. If you feel you cannot social distance in a hair salon or department store, don't go. If you don't feel comfortable dining in at a restaurant, then continue getting takeout or delivery for a while until you feel more comfortable. There are still some inconsistencies and unanswered questions with the governor's approach. For instance, how is it that we are able to be in most retail stores so long as those places operate at 50% capacity, while also needing to remain in groups of 10 people or less? And how will this all be enforced? Until we get answers to those questions, we must continue to be vigilant. We must continue to be smart. Wear your masks, wash your hands, stay away from large groups, and if you are at risk, please stay home as much as you can. Take care of yourself and those folks that you love and those folks you've never met. Thank you very much.
That is the end of our prepared remarks for today. I would ask our media professionals on the phone to indicate whether they have a question for any of our speakers. I'm going to first look to the GoToMeeting platform and then open it up to any callers on the phone. Are there any questions? I understand Mike O'Brien has a question on the phone. Mike, go ahead.
Yeah, this is for Stacy Walker. I understand you were quoted having concerns about the Linn County Test Iowa, given its liability with the percentage of tests coming back inconclusive. Some tests being completed. My question is, now that it's been validified by the state hygienics lab, does that ease your concern at all with the prior concerns you had on how the Test Iowa was being run in Linn County?
So Mike, here in the room that we are in, there is a train passing by. So part of your question was the train whistle blew while you were talking. So I'm going to ask Stacy to restate the question as he understood it, and then we will get you an answer. Thank you.
Surely, no problem. It was about, to Walker, your concerns about the Test Iowa in Linn County, its facility with some unreliability on coming back with inconclusive tests, as well as concerns about the timeline on how long the results were taking to come back. After Governor Reynolds' press conference this morning, talking about how validated now from the hygienics lab, does that ease your concerns at all, the prior concerns that you had with how the Test Iowa facility was running in Linn County?
So the question has to do with whether or not my concerns with the Test Iowa test results that are coming in from Cedar Rapids have been allayed now that the governor and her press conference this morning has announced that the results of the Test Iowa test results have been validated. I will just say this: so long as it is indicated to me that there is a significant amount of tests that are being returned as inconclusive, I will continue to be concerned, and I think public health officials here will also be concerned. I've been made aware that we are treating inconclusive test results as if they are positive. It's better to be safe than sorry, and I wholeheartedly agree with that approach. It's also important to note that nobody here is rooting for the failure of this Test Iowa project. This is an approach that the governor has instituted, and we are simply trying to do our best to accommodate that. And in order to accommodate this Test Iowa approach, I think it's incumbent upon all of us to ask these questions. Is it a problem with how the test is being administered? Is it a problem with how the tests are being stored? Are there issues with the integrity of the test itself? And I do think we need to be concerned about the turnaround time between when the test is administered and when our local health department is able to access the results of those tests. I do think it's an area of concern that our local health department is able to access the negative results of these tests that have been administered. Again, these are not questions intended to impugn the governor or the process, but if our local public health officials are going to be able to do the best they can to keep the public safe, then these are questions that need to be addressed.
Thank you, Supervisor Walker. Are there any other questions for any of our speakers today? Okay. I'm not seeing any coming through the chat function. Oh, there is one. Nope, I'm not seeing any come in through the chat function. So I think we're going to go ahead and conclude our press conference for today then. I do want to make a note that we are making a change to our regular press conference schedule, transitioning to once per week beginning next week. So we will, in the future, hold our press conferences on Wednesdays at 3:30, meaning that our next press conference is scheduled for Wednesday, May 20th at 3:30 p.m. I also want to pause to say a thank you to the people that make this press conference possible and help get this out into our community. So Jeff in India for MediaCom Communications, Hands Up Communications, ASL interpreters, especially Joan, Jennifer, and Amy, the Cedar Rapids Public Library staff, and our staff here within the county that set up and run the technology for the press conferences. Thank you to you guys. I also want to encourage people to join us for a virtual town hall tomorrow at noon to learn more about reopening safely in Linn County. There will be representatives from the City of Cedar Rapids, Marion Economic Development Corporation, and Unity Point Health that can answer questions on this issue. In summary of the Linn County metrics to date, there are 886 cases, 665 which have recovered, 68 deaths, and 144 that have ever been hospitalized. Please continue to practice social distancing, staying home when you're sick, and washing your hands often. Stay safe and stay home. Thank you.